Good morning, and thank you so much for the opportunity to be here and for me to introduce our partner, OffTheScale. My name is Abby Schwartz. I am the Director of Wellness at Mount Sinai Health System. As the largest employer in New York City, Mount Sinai believes that in order to provide the finest, quality-focused, and cost-effective health care, as well as research, both locally and nationally, we must first take care of our 40,000 employees. As many of you know, healthcare organizations such as Mount Sinai comprise a high percentage of the jobs in New York City, a true engine behind our local and state economy. However, in a very secretive manner, there is a silent epidemic that's growing throughout our communities and our employer base. The epidemic of obesity, prediabetes, diabetes, and cardiovascular disease is a growing epidemic that today affects over 50% of our workforce. This is a national and an international issue that employers face. If we do nothing, if we take no action, the quality and financial lives of our employees will be affected. In addition, the healthcare costs, productivity, innovation within our workforce will drop dramatically. In our parents' generation, the incidence of diabetes, obesity, cardiovascular disease didn't hit until people's 7th decade, 8th decade, 9th decade into life. Today, the incidence of diabetes, cardiovascular disease, which leads to kidney disease, heart attacks, strokes, is actually affecting our employees in their 20s, in their 30s, in their 40s, in their 50s. Just yesterday, I referred one of our employees to our diabetes care management program who was precisely my age and could barely walk 30 feet. At Mount Sinai, we have capitalized on our expertise in primary care, internal medicine, cardiology, nutrition services, and psychology. We have created a wellness initiative for our employees called Mount Sinai Fit. Now, employees have access to diabetes care management, personal concierge nutrition program, yoga classes, walking classes, and personal health coach. On Tuesday night, we just did a refresh of our data, and we are amazed at the impact of the clinical metrics, some initial financial metrics, productivity, that by simply engaging employees, spending 30 minutes with them has had on blood glucose levels, on blood pressure levels, on incidents of utilization events, and on missed days from work. We need to take these results and be able to scale them and blow them out through our entire health system of 40,000 employees. Mount Sinai has conducted a great deal of due diligence over the past 2 years looking at digital health and wellness companies. We were committed to finding the best in class. Mount Sinai has been working with the New York City Partnership on serving as a mentor for digital health companies. I was introduced to OffTheScale, to Billy Pim and Ashley Heather, and we have together created a wellness model that aims to impact all employees regardless of their current health status. OffTheScale brings highly engaged, highly motivated, and focused leadership. Mount Sinai invests a great deal of energy and effort in developing standard operating procedures, engagement strategies, implementation strategies, and we have found this in our partner. OffTheScale has walked hand in hand with us to develop engagement, operational, and the metrics needed to work in a seamless manner and to be able to demonstrate return on investment within a very short period of time. OffTheScale carefully developed interventions, including a highly skilled change agent, one we have currently in the room, Jay Cardiello, who will actually come on campus to our workplaces, to our hospitals throughout New York City, to provide personal wellness coaching, exercise classes, nutrition education for a 12-week period. Our employees will also receive the OffTheScale armband or exercise monitoring device, personal coaching, as well as a social media group. At the same time, they will also be invited to participate in our other wellness initiative. So we're very excited to be able to offer this for 12 weeks. And then OffTheScale has committed to our employees a 1-year commitment, so that after the 12-week wellness initiative, employees will have the option to continue to receive support for a 1-year period. This is not a gimmick. This is not a contest. It's not a short-term reward. This is a long-term lifestyle change that we believe this will bring to employees and their family members to optimize their quality of life, their work performance, and to reduce morbidity and mortality. I'm pleased to announce that Mount Sinai will be launching our OffTheScale Wellness Initiative just a few blocks away from here at 42nd Street and 3rd Avenue for 1,600 employees. In addition, we'll be launching the OffTheScale Wellness Initiative at our Beth Israel Medical Center at Mount Sinai West, which was the St. Luke's Roosevelt campus as well. Again, we believe that by marrying the relationship between OffTheScale and Mount Sinai, we can bring together the best in breed and clinical care delivery, and to be able to scale it through the services and application created by OffTheScale. I hope to return in a 1-year period to be able to tout our excellent results. Mount Sinai strives to serve as the gold standards in wellness initiatives, both locally, nationally, and internationally. I would like to introduce Ashley Heather of OffTheScale.
Thank you. Well, I couldn't have said it better myself. I think thank you so much to Abby, to everybody here, the mentors that we've been working with over the last 4 months. So excited to be here and talk to you about our business. Our business. This guy isn't moving, but that's all good. I'd like to introduce my family. This is Chloe, Lola, and Dash. Like many parents in the room, I love my family to death. So 2 years ago, when I read this quote, that if we don't reverse our nation's epidemic on obesity and chronic disease, this next generation will live sicker and die younger than we will. This is the first time in any generation that will have happened. Along with seeing my own personal family healthcare costs double, so 100% increase over the last 4 years, I was committed to, after I sold my last technology company, to get involved in healthcare and try and figure out how to be part of the solution. So myself and 2 partners, Billy Pim and Jay Cardiello, sat over there, set up OffTheScale to try and address the issue. So the first thing we did was we wanted to look at the landscape of what's going on in healthcare. Many of you from the healthcare industry in this room know these slides well, but just for a refresher, there's a huge shift today from volume to value. This is driving the need for population health management and giving better care at lower cost. So we set about looking at where the majority of the cost is. So on the left-hand graph under spend, you'll see that $1 trillion is spent per year supporting the rising risk category, which is the definition of 1 or more chronic diseases. If you have one of those, you're in this rising risk bucket. It's by far the largest spend. It's larger than high risk, no risk, and at risk, which are the other categories. The second graph is the population. There are 80 million, roughly 25% of people who are in this rising risk category. So an enormous number of people, target market to go after. The issue at hand is, when you look at how healthcare has been dealing with these people, is that you've got, on the one hand, expensive clinical care done on-site in the facilities, or you've got preventative care, which is targeted at those people who have yet to have a chronic disease. That's why it's called preventative care. It's there to prevent you getting a chronic disease. You have this enormous category, 25% of people, creating an enormous cost with no solution in the marketplace that addresses their need. Clinical care is too expensive. The hospitals are looking for community-based and partners in the marketplace to help solve it. So the question marks was our opportunity in the white space. So I'm either impatient or... So we set about creating, 2 years ago, we set about creating OffTheScale. OffTheScale is a chronic disease management platform at its heart. We are there to slow, stop, and reverse the progression of chronic diseases. That's what we are doing. You'll see here some of our participants in recent programs in the photo wearing one of our bands. So what have we been doing? For the last 18 months, we've run 400 people through the program. These people have come from physician referrals, employers, or community programs that we've been rolling out. And the progress and the statistics that we've got are pretty remarkable. In only 12 weeks, we've had 90% of people graduate the program. So for those people who start, 90% run with us through the entire 12 weeks. There was an increase in people's exercise of 44%. So that doesn't mean that 44% of people increased their exercise. It means that as a whole, there was a 44% increase in the amount of exercise done during those 12 weeks. 10% is a flag for doing well. We're at 44%. 89% lost body fat. We got a lot of other metric data. And to us, most importantly, 88% they will continue with the OTS protocols, OffTheScale protocols, for the rest of their lives. Then fast forward 12 months. We're only 18 months old, so we still have a limited window on this data. 75% have maintained or improved their health after 12 months, and 92% are now living what they call healthier and happier as families using the protocols that we've done. So what's the bottom line? For us, working with our partners, we've estimated a $2,000 a year saving per person per year, which is effectively about 20% saving on what most employers spend. It's about 10 grand a year that an employer will spend on an individual's healthcare, so 20% saving. So how do we do this? Those seem like amazing numbers. Well, we're pretty unique in our platform. For the first time, we combine the three main things you need to do to really change lifestyle. It's very difficult to work with these individuals with chronic disease who over the period of years and years and years have developed keystone habits that really are creating an unhealthy lifestyle. So the first thing is we need an exercise protocol that they can do that is not them going on a 5-mile run or joining an Olympic swim team. It's sitting in the chair, starting like this. Literally, that's how it starts. We've created these protocols in combination with Jay Cardillo, our partner, who I'll talk more about later, to make sure that they're modifiable so they can start sitting in a chair like this, and after a few weeks they can be standing, a few weeks later they can be moving around, and it's all video-based, so they get all this content. The second one is nutrition, education. We don't sell food, we're not a diet plan, but what we do is educate our people and put them in touch with our change agents in real time to be able to make meaningful changes in what they shop, what they put in their pantries, what they put in their mouths and in their families' mouths. And I'll explain how the technology works. And then the third is the lifestyle change, the behavioral change, breaking down people's keystone behaviors, identifying them, changing them, and then reinforcing them over time. And we've taken the best of evidence-based research in all these three domains and wrapped them up into one branded experience. I swear I am clicking the button. There we go. So the second unique part of our platform is it's multi-channel. The core part is a face-to-face weekly group meeting. To be a cost-effective solution in today's healthcare world, one-to-one does not work. Digital only does not work. It has to be a group-based delivery model. And so we have that. So our groups meet in classes of 20 people once a week for 1 hour face-to-face. We have a leader who leads the session and goes through our program and our experience. We support that with a once-a-week dial-in, a virtual dial-in through a phone call or a video chat, and a social network where these individuals can talk to each other, share their experiences through the program. That's what we do at the group level. At the individual level, everybody has an app. The app covers the three domains of our business. So it contains a lot of content about nutrition. It connects you real time with our change agents who are trained dietitians. It provides content on the exercise. It tracks through our band. Everybody gets given one of these bands. And this is pretty unique. It's not our technology, it's Garmin. We partner with Garmin. It's the only product that has a 1-year battery life. It's completely waterproof. You never have to take it off. And it also has group syncing technology. What a lot of you don't realize is the target audience that we're going after, many of them don't have smartphones, or they have them and they don't know how to use them. They're what we call no-tech or low-tech. We have lots of high-tech people too, but we've got lots of no-tech and low-tech. This product allows us to sync all the data off when the individuals walk into the room each week, and they never have to download an app. So we've designed our program to work not just with the smart folks with the smartphones, but also broad America, because we know we need to change a lot of people's lives. And all of these tools feed into the central dashboard, which is our main hub of our business that I'll talk more about. There we go. So at its core, we are a blend. We're a blend of old school and new school. We're a blend of people getting together face-to-face in community centers, school halls. These are not our own facilities. We leverage community resources to get people to meet together with our technology. People are using our apps to take a picture of everything they put in their mouths. That data is going real time to our team of professionals who are giving them guidance week by week. Here's how to put more water in into your diet. Here's how to reduce your plate size. All the tips that you need to do to change behavior about how they eat. It syncs up with the band to show them their exercise and their movement. And I think this is today's new goal. If you look at the headlines, Saks bought Gilt. An old school offline company bought a new school online company. It's the blend of online and offline. GM invested $1 billion in Lyft. Why did they do that? Okay. So we have a dashboard, and we have a lot of reports that we send to our teams so they can track the behavior. The team, myself, Jay and Billy, I talked about, we have providers from payers, providers, health policy. We have a dedicated team, 6 in the product, 2 in operations, and 8 delivering our program. We're live in New Jersey and New York right now with these individuals. We call them our change agents who are delivering our program. I've been told to wrap up, so I'm going a little bit quicker. We're going to improve 1 million lives in the next 5 years. We're already on that journey with the Mount Sinai deal, 20,000 people, Wake Forest, 20,000 people, City of Atlanta, 20,000 people. So this is just in 2016. Our model is simple. We partner with the healthcare, we license our platform. It's roughly $500 for the 12 weeks, $1,000 for the 12 months. And we have a shared risk model which works with value-based care. 35% up front, 45% at the end, and 20% based on hitting the metrics and outcomes that we target. I'm going to play a very short video.
My off-the-scale experience has been magical.
When I completed the program, I went back to the doctor and he said I made remarkable progress.
What makes OTS different is the knowledge you learn.
It doesn't put restrictions on you, and it gives you the freedom to be the best person you can be.
You know, I'm more confident.
I didn't feel the pressure of the scale. A life-changing opportunity.
So thank you very much to New York Digital Health. Thank you all. I'll just say, if you're running a population group and you need to lower your costs, please come and talk to us. If you're an investor and you want to be part of the next big unicorn on the East Coast, come and talk to us. With that said, thank you very much.